Hello friends, today we'll discuss about the gram-negative bacilli. My previous session was about gram-positive bacilli and now we'll cover the gram-negative bacilli. Okay, so first you want to know some of the general specific characteristics of the Enterobacteriaceae. Okay, first they are the gram-negative bacilli. They are the aerobe and can be facultative anaerobe, but they are non-fastidious because if the fastidious organism, they will be requiring a special medium like blood agar or the chocolate agar. Okay, but here it is a non-fastidious, so they can grow in an ordinary medium like nutrient agar. So, and it will be fermenting the glucose and also reduces a nitrate to the nitrate. So here the oxidase test is negative and catalase will be positive. So catalase will be positive in all except the Shigella dysentery, where it is in catalase, it will be negative. Okay, so this point, and these are usually motile, but Shigella and Klebsiella are non-motile. So what natural habitat means, they will be usually of the commensal of the human intestine, that is they are called as a coliform bacilli. Okay, so these are the 6 characters you want to remember. So among the Enterobacteriaceae, first we will be dealing with E. coli. Okay, so as the term E. coli, you always remember it usually causes an urinary tract infection, right? So urinary tract infection usually caused by the uropathogenic E. coli. And next it is in diarrhea, it is usually caused by the diarrheal strain, that is it has 6 types. Okay, so another important point you want to remember is this E. coli is the most common organism for causing both the primary bacterial peritonitis and secondary bacterial peritonitis. And it also causes a pneumonia usually in the hospitalized patient, that is a ventilator associated pneumonia, and also causes a neonatal meningitis, wound and the soft tissue infection, osteomyelitis, and endovascular infection and the bacteremia. Okay, so these are the diseases which is caused by the Escherichia coli, and you want to remember the main point is UTI and the diarrhea. Okay, so next, what are the toxins? So exotoxin, it has 3 types, that is an heat labile toxin, heat stable toxin, and it is a virocytotoxin. So heat labile toxin, it is by camp. So already I told you the camp will be in Bacillus series, the diarrheal type, it is by the same mechanism, and heat stable, it is usually acted by increasing the cyclic GMP, and virocytotoxin, what happens is it decreases the protein synthesis by decreasing the ribosome pattern. Okay, these are the exotoxin. So next, coming for an important concept, that is a cause concept of bacteria. So whenever there is a urine culture has been taken, and if you are giving a result, always make it up. If it is more than 10 to the power of 5 colonies only, it is considered as significant. Okay. This is considered as significant. If it is less than 10 to the power of 4, it is considered as an commensal bacteria. Okay. So this is an important table you want to remember. I told you diarrheogenic strains. So here, first, it is an enteropathogenic E. coli causes an infantile diarrhea. So P for pediatrics. So it usually causes an AE lesions, that is an attaching and effacing lesion. And coming for here, enterotoxigenic E. coli T. So it causes a traveler's diarrhea. It is mainly by the colonization factor antigen. So enteroinvasive resembles a shigellosis, and here the serenity test is positive. Okay. So next, it is an enterohemorrhagic E. coli. This is an important, that is an 157 and H7. O157 and H7. This is the most common serogroup causing this type of infections, and it usually causes an important complications like hemorrhagic colitis and the hemolytic uremic syndrome. So enteroagglutinative, it causes an A for A, acute diarrhea, and it also causes an persistent diarrhea. So this is an important table and you want to remember this. So next, coming for Klebsiella. So you want to remember 3 species here. Okay, so one is Klebsiella pneumoniae, Klebsiella ozaena, and Rhinoscleromatis. So coming for Klebsiella pneumoniae, it causes a pneumonia, UTI, abdominal wound infections, and surgical infection. Whereas ozaena, it causes an atrophic rhinitis. You know, it is called as a merciful anosmia because the patient can't find anything odd, but the surrounding people, they will be having and somewhat typical or the bad smell, that is a foul smelling nasal discharge, and rhinoscleromatosis causes an rhinoscleroma. Okay, so next it is in Proteus. So friends, again I am saying I am posting only the important points. Please do not let even a single points out. Okay. First, it is in motile, non-lactose fermented. The specific test for Proteus, it is in PPA, that is in phenylalanine deaminase test. It has a peculiar order called as a fishy order or seminal order. And Diane's phenomenon, if there are that is two species, one is mirabilis and vulgaris. If you are sticking in a plate, if it is two species or similar, they will be meeting together. If they are if there are different species, they will be moving away from the central line. So it usually forms as two white stones in the bladder in the alkaline urine. This is an important, okay, it's two white stones. So next, the Wheelflix test is positive, that is OX19, OX2 and OXK. So next species is Salmonella. Okay. So here you want to remember the Salmonella, what is species here is typhi, paratyphi A, paratyphi B and the paratyphi C. Okay. So here what are the most common root, you know? Yeah, fecal-oral root, and usually causes in staphylococcus fever, and there will be rose spots, and longitudinal ulcer will be there in the intestine, and GI hemorrhages. So whereas longitudinal ulcer usually present in Salmonella, whereas transverse ulcer usually seen in the tuberculosis. Okay, so you know the from first week, second, third and the fourth week, that is in BASU. If you are suspecting first week the patient comes, you can do blood culture. Second week it is an agglutination test, that is an viral test. Third week you can go for the stool culture, and fourth week you can go for urine culture. So what is the blood you will be taking? It is in 5 to 50, 5 ml the blood and the 50 ml of the broth. So what is the significant titer for the O? It is in 100, 1:100, and H it is in 1:200. So these are the important points for the, okay. So next, Shigella. So Shigella, you want to remember this point again. The most common cause of Bacilli in dysentery in India, it is in Flexneri, whereas in the world it is in Sony. And Ekeri syndrome, it is a metabolic complication of the Shigella. Okay, so coming for the enrichment medium and the selective medium for both the Salmonella and the Shigella. So enrichment medium for both, it is in salinity of broth, and transport medium it is in sac buffered glycerol saline, and the selective medium here for Salmonella it is in Wilson-Blair medium, whereas in Shigella it is in DCA. Here Wilson-Blair medium usually produces jet black colored colonies. So next, coming for Pseudomonas, you know, exotoxin A. So it is a principal factor, and I told you it is similar to the Corynebacterium diphtherium, okay, because these both will be inhibiting the elongation factor. So this is the most important virulence factor, though it inhibits the protein synthesis by inhibiting the elongation factor too. So what are the pigment produced by Pseudomonas is pyocyanin, fluorescein, pyorubin and pyomelanin. So this cyanin, it is a blue-green pigment. It is produced only by the aeruginosa. Okay, so none of the other species will be produces this. So fluorescein, it gives a greenish yellow in the color, and rubin, harfar or red color, melanin, you know, black color, so brown black color. So what are the clinical manifestations of this Pseudomonas? So swimmer's ear, malignant otitis externa, Shanghai fever, ventilator associated pneumonia, ecthyma gangrenosum and Burns wound infection. So there will be history like, okay, a patient came with 100% burn and he had a typical skin infection. So what antibiotics you can give? So what the organism you are expecting? So if there is a burn, means the first organism to be causing an infection, it is in Pseudomonas. So next it is in Burgholderia and Burgholderia pseudomallei. So mallei, it is a non-motile, pseudomallei, it is a motile. So both are bipolar strained. So the mallei causes in glandus and farcy in the horses, whereas pseudomallei causes in melioidosis or the Vietnam time bomb disease. Okay. So next, It is in Vibrio cholerae. You know the famous mnemonic called as a coin test. That is a catalase positive, oxidase positive, indole positive, nitrate get reduced, and steam test. It is, you will be using 0.5 percentage of the sodium deoxycholate. Typical motility, that is a darting motility. Again, the darting motility is shown by Campylobacter. So fragment B and fragment A. This fragment A usually causes an what ADP ribosylation of G protein. Nothing. Fragment A for A. Just remember camp. It increases the camp and causes a rice watery diarrhea. Whereas typhoid causes an pea soup diarrhea. Okay. So fragment B usually binds to the gangliosine receptors of the GI epithelium and causes an secretory diarrhea. So what are the transport medium for the Vibrio cholerae? It is in Venkatraman Ramakrishna medium or Carry-Blair medium. And enrichment medium, it is an alkaline peptone water. Selective medium, thiosulfate, citrate, bile salt, sucrose medium. So here the colonies will be producing an yellow color. Okay. So here the medium will be green in color, whereas the colonies will be yellow color. So coming for the halophilic vibrios, Vibrio parahemolyticus, vulnificus and alginolyticus. So this is a maximum salt tolerant, and vulnificus are called as a wound maker. Okay, so most common in the wound infections. And this alginolyticus, it is usually causes a Kanavaga phenomenon, that is in beta hemolysis on the Vagatsuma agar. So coming for Haemophilus species, so they want to remember these three. So one, it is an influenzae, Ducreyi and Egypticus. So here influenzae, it is encapsulated strains causes an meningitis and epiglottitis, while non-capsulated strains causes an lower respiratory tract infection and the sinusitis and the otitis medium. Okay. So coming for this Ducreyi usually causes an cancroid, which is characterized by painful lymph node, tender, non-indurated ulcer. So lymph node will be painful. Okay. So you know because of this the cry. So because of tender, the patient is crying, and there is a for going the school going kids will be crying. So there is a school of fish in appearance or railroad appearance, whereas Vibrio cholerae, it is in fish stream appearance. So coming for the factors, see this is somewhat bigger name, influenza, Egypticus. So they require both the factors X and the V, whereas here Ducreyi remember only X. So Haemophilus influenza, that shows a specific, that is an important called satellitism. And here the Egypticus, pink eye syndrome or the Brazilian purpuric fever. These are the point you must not forget. Okay. So next coming for Bordetella pertussis. So it is also called as an whooping cough or 100 days cough or 100-day fever or barking cough. Okay. So here the main toxin is pertussis toxin, and it is similar to cholera toxin. So it will be acting by the camp. Okay. So what are the stages is, it has a catarrhal stage, paroxysmal stage and convulsant stage. So catarrhal stage is the most infectious, and paroxysmal the patient presents with an whooping cough, and convulsant stage usually patient in the recovery stage. So coming for Bordetella pertussis, so what a specimen will be taking is nasopharyngeal aspirate. So medium will be using and Regan and low medium. Regan and low medium or bordered Gengu medium. It is in selective medium, and the colonies will be like mercury drop appearance, bisected pearl appearance, or the aluminium thumbprint appearance. Okay, what are the cultures here? See, the Cocoa Bacilli will be arranged in thumbprint appearance. This only I was saying that it is in thumbprint appearance. So coming for Brucella, so there's a 4 important species. So melitensis affects the sheep, goat and the camel. Abortus affecting the cattle. Suis usually affects the pig, and Canis usually affects the dog. Okay. So here, what is the Brucella? So what is the most common mode is by only any contact with an infected animal tissue, mainly the milk. Okay, so consumption of the raw milk or the dairy product, they are usually airborne. So what is the classical triad here is, the patient will be present with fever with night sweat, there will be an arthralgia, arthritis or hepatosplenomegaly, and there will be an undulating pattern of fever that is called as an Malta fever or the Mediterranean fever. And this antibody detection test, that is an important test which is called as an SAT test, that is a standard agglutination test, which is a gold standard test for the brucella.